My medication's name is Trazodone. Trazodone comes in two brand names. The first brand name being Deserel and the second being Eleptro. Eleptro is the extended release version of Trazodone. Trazodone is a serotonin receptor antagonist and reuptake inhibitor, and it belongs to the class of serotonin modulators. Indications and usage approved by the FDA is for depression, especially in MDD. However, it is used primarily off-label for sedation, and that is used in anxiety and panic disorder. The maximum dose a patient should have per day is 400 milligrams tops. They advise the patient to have it with a meal or a light snack, and you want to make sure to discontinue it with a gradual dose to avoid discontinuation syndrome. Contraindications for this medication is if a patient has an MAOI in the last 14 days. Warnings and precautions also to be cognizant about with your patients is serotonin syndrome. Your patients will be at an increased risk for serotonin syndrome if you co-administer this medication with other serotonergic agents such as SSRIs, SNRIs, and triptans. Cardiac arrhythmias is also something to be cognizant about because it increases the QT interval. So you want to avoid use with other medications that also increase the QT interval of patients, and also take in consideration a history of dysrhythmias. Orthostatic hypotension is also something to be worried about in your patients, especially if a patient has a history of orthostatic hypotension or they have a history of low blood pressure. You want to make sure they report any episodes of dizziness. You want to make sure that you tell them to get up slowly, and if they have any syncope episodes at home, you want to make sure they report it right away to their doctor. They're also at risk for increased risk of bleeding, especially if a patient is already prescribed low-dose aspirin or an anticoagulant. Priapism has occurred also, and then there's an activation of mania or hypomania, which may occur in people who have not been screened for bipolar disorder, so it is important that you screen for bipolar disorder in your patients before administering this medication. There is a potential for cognitive and motor impairment on this medication, so you want to advise your patients not to drive because of the sedating effects of Trazodone. Angle closure glaucoma is also something to be cognizant about. You want to avoid the use of antidepressants and SSRIs because it untreated anatomically narrows angles. So if your patient is having any vision changes, you want to make sure that they go and see an eye doctor. The most common adverse reactions on Trazodone are edema, blurred vision, syncope, drowsiness, fatigue, diarrhea, nasal congestion, and weight loss. For drug interactions to be aware of with Trazodone, so Trazodone is a CYP3A4 substrate. It affects CNS depressants and enhances the effects of alcohol, barbiturates, and other CNS depressants. For CYP3A4 inhibitors, you want to maybe reduce the dose of Trazodone. For CYP3A4 inducers, you want to increase the dose of Trazodone. And if a patient's taking digoxin or fentanyl, you want to monitor for increased digoxin or fentanyl serum levels. And for warfarin, it can affect your patient's prothrombin time either with increase or decrease, so you want to make sure to monitor that. In patient-specific populations, it is advised to not take it in humans. There was a study done on animal data that it may cause fetal harm, so to be safe, you should not prescribe it for people who are pregnant. And for breastfeeding mothers, nursing mothers, it is advised not to, since it does go into the breast milk.